Obviously, with the opioid crisis, and as Representative Rothman mentioned earlier, in Cumberland County, we're very proud we have both the drug court and the opioid court, which we believe work very well. But when I was taking a look at some of the numbers across the board of some of the measurements that you had, the program measures, which I think is great that we're able to measure what it is that's who are being served. For outpatient treatment, I was taking a look at the 3-year comparative. We have 17-18, there were, the typical length of stay was 77 days, and for 18-19 and 19-20, it was 44 days. So my question is this good or bad? Because to me, I would think that the additional treatment or people just not finishing, and why the change, that's pretty significant. It's like about 43%, that reduction. And from my understanding, treatment needs longer time in. So why the step back?
First, I appreciate that you're looking at the program measures. That's very exciting to us. Unfortunately, what I have to share is that you have to really be cognizant of what you're looking at with our program measures, because these program measures are specific to the individuals for which we provide funding, which would be the uninsured population. So this is not average length of stay or average days in treatment for individuals on the Medicaid program or for individuals with private insurance. Our department does not have access to those numbers. In some cases, some of the Medicaid data is actually reported under the Department of Human Services. Under some of the Medicaid data, there is some information there. This information is very specific to just the clients that are funded through our state funding or our federal block grant funding. Okay. That's why the trends can look a little funny, because sometimes if more and more individuals are enrolling in the Medicaid program and our population is diminishing, or perhaps we're only paying for 2 or 3 days worth of treatment for an individual and then they're flipping over to a Medicaid funded service, that can really throw off some of the averages that you see here.
Okay, but still the ability, so basically then if we have this data, it's not able to, because I'm looking at 77 to 44 assuming the same, and so what you're telling me is that's irrelevant? So it doesn't matter what we do year to year because it's never going to be the same audience?
It is very difficult to utilize program measures that we have access to as a department to paint the entire picture for the drug and alcohol treatment system. Because we do not have access to full data that would paint the entire private insurance and Medicaid picture.
Okay, because I thought the Centers of Excellence, the whole idea was to give longer level or lengths of treatment, and so now we're showing that they're getting less time.
And so the Centers of Excellence are actually administered through the Department of Human Services, and so their data would be reflected through the Medicaid data, and they have data to show that lengths of engagement have been longer as a result of those programs.
Okay, and one other question before time runs out here: the individual that's in recovery, and I know that Secretary Levine talked about the medical treatment. So I just want to clarify something: is an individual in treatment in recovery, are they required to maintain a certain amount of outpatient time and treatment in order to continue getting MAT, or are they able to just go to one counseling session, kind of fudge it a little bit, and then still receive the MAT? Is that
so? Again,
are they required to get continue counseling for a duration?
Sure, I can understand what you're asking. It's important to remember that we're talking about a medication which could be prescribed by a primary care physician, or it could be administered through what we call a licensed treatment provider. So there are licensing requirements through our department. If there are medications being administered in those licensed facilities, there are requirements around counseling. If medication, however, is being prescribed to an individual with a substance use disorder outside of our licensed facilities, we would not have jurisdiction over monitoring whether there are any requirements by that provider in terms of issuing that prescription to a patient.
Okay, because the whole point, and as we move through this, is that there's resources out there, and we want people to get the right treatment in order to break the cycle.
Absolutely.
And not be addicted to drugs or alcohol. And I just would put a plug in there before time runs out as to with the drug courts. We've been very proud of what Judge Maslin and Judge Brubaker have been able to do within Cumberland County, and I've sat in on a lot of those graduations for the drug courts, and it's it's pretty amazing to watch how low some folks will have to go in order for them to decide to change their lives. So I would advocate for those types of programs. Thank you.